This lecture is going to talk about regenerative medicine as a viable option for runner's knee, chronic back pain, rotator cuff injuries, and more. A little bit about me. My name is Rachel Gunderson. I am a nurse practitioner and the CEO of Joy Wellness Partners Utah. My background is I got my master's degree from the University of Pennsylvania in Philadelphia. That is where Carol and I actually met. After graduation, I moved to Texas and worked in Houston in the hospital setting. I have done ICU, I've done the code team, rapid response, I've done cardiology, internal medicine, IMU. I've done pretty much about everything in the hospital. And then in 2021, I moved to Utah with my family and opened the Utah side of Joy Wellness Partners in January of 2024. So we're about 2.5 years in and loving all of the regenerative aspects, this clinic and all the great things we have to offer. And so, So to start off with, a lot of times people always want to ask me, what is regenerative medicine? And so regenerative medicine is a field of medicine that focuses on repairing damaged tissues to restore normal function. It uses techniques like stem cell therapy, tissue engineering, and the use of biological materials to promote the body's natural healing process. By regenerating healthy tissues and organs. And regenerative medicine actually has a long history that spans several centuries, beginning with early attempts at tissue repair and transplantation. In ancient times, we have record of concepts of tissue regeneration, and there are myths and rudimentary practices that hint at the body's ability to heal itself from ancient times. In the 19th century, there were advances in cell therapy that laid the groundwork for understanding regeneration at a cellular level. Then in the 20th century, we had significant milestones, including the discovery of stem cells and the development of organ transplantation techniques. And then in the 21st century, modern regenerative medicine as we know it today emerged, incorporating, like we said, the stem cell therapy, tissue engineering, and molecular biology to help treat previously what we thought as incurable conditions. So for the point of today's lecture, there are a lot of different ways you can take regenerative medicine, but we're going to focus primarily on the orthopedic avenue for regeneration. We're going to start by looking at 3 main groups of things we use for regenerative medicine. First is platelet-rich plasma. So platelet-rich plasma, or PRP, is a treatment that uses a concentration of a patient's own platelets to accelerate healing of injured tendons, ligaments, muscles, and joints. So platelets are the cells that are in your blood supply naturally that help you heal and regenerate. Anytime you get a cut, what happens is your blood comes to that area, and when your platelets are exposed to air, they burst open and they release a lot of cellular messengers and growth factors that signal for all the stem cells to come and regenerate the tissue. And so really it's the platelets that help instigate that and start that process. And so when we do PRP treatments, what we're doing is we are drawing a patient's blood, we put it through a centrifuge, which is something that spins it down. And so what happens is the platelets all get concentrated in the patient's liquid portion of the blood, which is the plasma, hence the name platelet-rich plasma. And then we take that and we inject it back into the areas that we are trying to focus on healing. It is a relatively easy procedure to have the blood drawn, and it's the same as having blood drawn for labs or other things. And so it's not a bad procedure to do. And we are able to do it, as this says, into tendons, ligaments, joints, muscles. There are just a few places that we're not able to inject PRP, but we're having really great success with it so far. And then the next one we're going to talk about is called alpha-2 macroglobulin. It's another one of our favorite regenerative solutions that we use when we're treating orthopedic injuries. So alpha-2 macroglobulin is a large protein that is found in the blood and plays a crucial role in inhibiting enzymes involved in cartilage breakdown. What it does is it acts as a natural protector against inflammation and tissue degeneration or degradation, making it useful in treating osteoarthritis specifically and other degenerative joint diseases. And what it does is it binds to and neutralizes the destructive enzymes. So that way the cartilage is able to be preserved and to promote joint health and regeneration, especially when we add it to other modalities, when we use like our PRP as well. And it can really help with reducing pain and improving mobility in patients that have joint damage. So this is one that is really good in all of our joint space or we call it A2M, as it says is found in the blood. So it is processed very similar to when we're doing PRP. If you look at this picture on the slide, that liquid part at the top, the yellow part, we call that is the plasma. And so that's the platelets are in that part of the blood. So we do it the same way. We draw the blood as if we're drawing blood for PRP. We draw it out, we spin it through a special centrifuge, and then we pull out the top part. PRP sometimes gets nicknamed liquid gold because of its gold color and because of the great healing properties that it has. But once we have that gold portion, that liquid portion of the blood, we then use a special filter that concentrates down the alpha-2 macroglobulin because it is available in just floating in the PRP, that plasma, but it's just not concentrated as much. For example, when we get when we are doing an A2M injection, we end up with about probably 30 to 40 cc's of PRP, of the liquid portion of the plasma, and we're going to concentrate it down until it's only about 5 cc's of liquid, because putting 30 or 40 cc's of liquid into a joint would be incredibly painful and not very helpful. But by concentrating it down, we're making sure that all of those big proteins, those macroglobulins, are concentrated so that we're able to give a small amount of the plasma, but have it be very hard hitting and very impactful. So it's also another really easy procedure that is done in the clinic. I didn't mention, but all of our pain and relief or pain and injury treatments where we use our regenerative solutions are done under ultrasound guidance. So we're able to ensure that we're getting those very valuable and great products within like a millimeter of where your injury is, so that we can ensure that it's having the best impact. So then our next product, regenerative solution that I wanted to highlight as a whole is called growth factors. And this can include Wharton's jelly, placental tissue matrix, secretosomes. It's kind of more like stem cell type products. We use stem cells in the more broad sense of the term instead of true mesenchymal stem cells. So like I said, I am practicing in the state of Utah, and this last year, we were able, our state legislature passed Senate Bill 199, which states, and it went into effect May 1st, and we're so excited, but what it says is that a healthcare provider whose scope of practice includes the use of stem cell therapy may perform a stem cell therapy that is not approved by the US FDA. And so I do have to put that out there that that a lot of these growth factors that we talk about are not FDA approved. But in the state of Utah, we had this great bill passed that allows us to use certain stem cell therapy. And so those include byproducts from deliveries. And so that includes Wharton's jelly is one name that it goes by, or placental tissue matrix is another name that's also synonymous with amniotic suspension allograft or connective tissue matrix. Sometimes they go by different names, but that's what we'll be referring to, because in the state of Utah, that's what we are now able to use. So we won't talk about secretosomes, but Wharton's jelly and placental tissue matrix are biological materials used to promote the regeneration of damaged tissues, reduce inflammation, and improve wound healing in various medical applications, including orthopedics and wound care. So they come, as it says, it is a byproduct of a childbirth. So what happens is the products are donated tissues, same as if you were to donate a tissue from like any type of organ. They come from a live, healthy baby, healthy mom, cesarean delivery, so a C-section delivery. The placenta and the other tissues are donated products that then go to an actual tissue bank where they are tested. And the same way as I mentioned, like other organ systems or donated organs and tissues are tested to make sure that they are free from any type of diseases or any issues like that. And then they are processed down and put in, the cells are so small you can't see, they look clear, but they're put into a liquid vial, kind of like what's on this slide. So then you can draw them up and inject them. And so these are a great product, especially I really like these products. In my opinion, I think of these in my practice as a little bit more my bigger heavy hitters for my patients, because the thing you have to remember about PRP and A2M, that is your own donated product. And so it depends on what your platelet count is and what the state of your platelets are, where the Wharton's jelly and placental tissue matrix are a donated product, and they are so full of a rich mix of growth factors, collagen, and extracellular matrix components that are super vital for healing and tissue repair. And so we use both of them, very common in our practice. In my practice, I use both. But I do find that if we question a patient's not validity, how strong their platelets might be or how impactful they are, then we will opt for the donated tissue or the donated product. Or if a patient is older, because you have to think about, just generally, we recognize that as people age, they don't heal as well, and that partially has to do with how their platelets function. Platelet function decreases efficacy and efficiency as people age. And so if I'm looking at two patients that are both complaining of like a torn ACL, and one of them is a 75-year-old female, and my other one is a 22-year-old female, I'm more likely to say that PRP would be a good option for my 22-year-old female, and for my 75-year-old female, move more to Wharton's jelly. But I do have younger people who just want to ensure that they get the best growth factor and like the best option for them to have the growth factors, the Wharton's jelly or the PTM. Those patients will use them. So it's not a hard and fast rule, but it's kind of what we start to think about is when we're doing these procedures and chatting with people, is looking at those things. So those are the three things, the three like big products that we like to use is the PRP, alpha-2 macroglobulin or A2M, and then growth factors such as Wharton's jelly and placental tissue matrix. So then when we look at what kind of conditions we're able to treat, we're looking at osteoarthritis is a really big one, and this can be degeneration of joint cartilage and underlying bone. And this can happen in any joint, from the joints in your hands to our bigger joints like our knees, our hips, our shoulders. And so we can look with our ultrasound and kind of see what's going on. So injuries such as tendon injuries, such as tendonitis, and that can be partial or full tears. I do have a really cool study that I'm going to highlight here in a couple slides that talks about where these injuries are and like using these types of regenerative solutions on them. So also ligament injuries. So ligament injuries can be ACL, MCL, those types of things. It can also have to do with tennis elbow, golfer's elbow, milkmaid's elbow, all those kinds of things that we like to talk about. They can be really good and treated with that. The cartilage damage in the joints, like we talked about, alpha-2 macroglobulin is prime for that because it kind of goes along with the osteoarthritis, but since it goes and traps those enzymes that are breaking down the cartilage and inhibits them so that it's a really cool system where they actually are just trapped in the molecule, this macromolecule, and then they're not able to be used. And so that's really helpful. Bone fractures, if you have a break that doesn't need to be set, or even after it's been set, like we had a patient who is a farrier. He was shoeing a horse and got kicked in the leg, and he actually broke his fibula, and he broke his tibia. I apologize. He broke his tibia, and it wasn't displaced, and so he didn't need surgery, but we were able to treat him with our growth factors, and he had a really great response and healed up really nicely. But it can also be used if you have had, if you needed to get surgery, it can also augment to make sure that you promote that healing really well. So muscle injuries, if you tear a quad or a bicep, I feel like recently we've been seeing a lot of bicep tears in my clinic, with people who are getting these from lifting too heavy or not lifting with good form and support. But that's another really easy one that we can treat with PRP or placental tissue matrix or Wharton's jelly. And then plantar fasciitis. This is another one. It kind of goes along with our tendon injuries. It's just the inflammation at the bottom of the foot. That is really helpful. Another one that goes along with plantar fasciitis, kind of in the tendon injury, is actually carpal tunnel syndrome. A lot of times people are told the only way to treat carpal tunnel is surgically going in and clipping that tendon, the tendon right there in your wrist, so that there's not the swelling and the entrapment on that median nerve that goes into the hand. But regenerative therapy is actually a wonderful option, and we've had really great success treating carpal tunnel syndrome with PRP and hydrodissection. And that's another topic that we aren't going to get to this time, unfortunately, the hydrodissection. But it's just another really great option to help avoid surgery. And so I love research. And when I talk to my patients in my clinic, I always make sure that they recognize that everything that I'm doing, I always back with research. It's never good enough for patients just to take my word for it, and I don't expect them to. And so I pulled out some of my great studies that I've had about using these regenerative solutions to treat these types of injuries that are really common, that sometimes people feel very discouraged about. And so this is a return to play after and I'm happy to get these all, we'll get these, the links to these studies, because I wasn't able to put all of it in there. I tried to get as much as it and I can, but on the slides, but So what this is this is an injury, common in throwing. The UCL is the ulnar collateral ligament. It's in the elbow. It's on the medial side. So it's kind of that spot where a lot of people hit and they call it like hitting their funny bone. But this is pain that is common with throwing injuries, like in baseball or in golfer's elbow. This is when people talk about golfer's elbow, this is this side. But what they did, is they took 50%. They had 50 participants in this study, and they had 4 different grades. When you grade tendon tears, there's 4 different levels. Type 1 is a very low grade tear. Type 2 is what they consider a high grade partial tear. Type 3 is a complete tear. And then type 4 is a tear in more than one location. And so of those, they gave them all PRP and then did rehab, so physical therapy after. And in all of the study, in all of the groups, they had improvement except the type 2 or type 4, which is more than one tear in the tendon. That one did tend to need a more surgical intervention. But in type 1, so partial, low grade partial tear, type 2, high grade partial tear, and then a complete tear, they all returned to surgery or returned to play quicker and had really good outcomes. They just looked at the amount of A2M in the synovial fluid, which is the fluid around the joint, and the amount of arthritis, and they just found that there was a better outcomes for patients who had higher amounts of alpha-2 macroglobulin. And they were specifically looking at post-traumatic arthritis. So that's if you tear an ACL or another ligament in your knee, you're more likely to develop osteoarthritis. So that breakdown, which kind of makes sense. You've had trauma, and so your structures aren't well protected. So you're more likely to develop arthritis in that joint. And so they found that the higher concentrations of A2M, the alpha-2 macroglobulin in the fluid that protects the joint, led to decreased amounts of osteoarthritis. So there's that study. And then for the amniotic suspension allograft, or a study for placental tissue matrix, these growth factors, which come from donated tissues. In this study, they took 200 participants and they were looking at osteoarthritis in the knee, and they put them in 3 groups. These 200, it was a randomized study, which in the world of research is like the best, one of the highest level of studies you could do. It was a blinded study. So they took 200 participants, and patients either got the amniotic suspension allograft or the placental tissue matrix, same thing, just different name, or hyaluronic acid or saline control, meaning nothing. And they put them into these 3 groups, and then they tested them at 3 months and at 6 months, and looking at the patient's reported symptoms and also how well they were able to move. And in all of the parameters that they were looking at, the suspension allograft or the PTM, the placental tissue matrix group, significantly outperformed and did better with their patients, especially with pain. They just saw a really great improvement. Those patients who got the donated product had much better outcomes and reported much less pain, even at 3 months, compared to the hyaluronic acid and the saline control. So we see, right, we got good research, but why not just choose surgery over these regenerative solutions? So one of the main reasons is that doing regenerative medicine is minimally invasive. Instead of having to cut a patient open and go in and physically redo things, we're usually just doing stuff under ultrasound guidance and just doing injections through the skin. And so we don't have that how invasive surgery can be. And really quick, I do want to say, please don't misunderstand that there are certain things that do have to be treated surgically. I am not naive enough to think that regenerative medicine can treat every and all types of injuries or orthopedic conditions. But there are a lot of really good, it does treat and is a really good viable option for many treatments or conditions that we sometimes think that surgery is the only option. So I just want to put that out there. But it is less invasive. Regenerative medicine is less invasive than surgery because we're not actually cutting into the tissue. There are lower risks for regenerative medicine procedures over surgery. The top 5 risks for regenerative medicine or for surgery, I just went into AI and asked like what they would list as the top 5 risks. Are infection, right? Because we're cutting the skin. Anytime you cut skin, you increase the risk for infection because our skin is our number 1 barrier to infection. There is a risk for blood clots because after surgery, you are told to be immobilized for a while, and we're going to talk about that as well. But there's an increased risk for blood clots. You are at increased risk for nerve damage. I see a significant number of patients in my clinic who have had surgery and deal with nerve damage post-operatively, and we are now trying to treat them with regenerative measures. And this is not a knock on surgeons, it's super hard, right? We can't always see below the skin when we are cutting things. And so my surgical colleagues, I know they do their best to try and avoid damaging nerves, but unfortunately, it's just one of those risks that we take when we do surgery. Bleeding, once again, from cutting the tissue, and then just issues with poor healing, because it's just more tissue has to heal when you do a surgical intervention. So low risks, natural. So the other reason to choose regenerative medicine over surgery is natural healing, because that's the basis of all regenerative medicine. We are trying to support the body doing what it has been designed to do and give it the products and the tools that it needs to heal itself and regenerate. And so I think that's always great than trying to add in things that we necessarily don't need or our body won't need. Reduced downtime. For most surgeries, once again, because it's very invasive, there's a lot going on. Surgeons will give patients a long time when they want them to have like quote unquote downtime. So if you have an ACL repair, your downtime can be anywhere from about 6 months to 12 months. Or if you're looking at a rotator cuff injury, so something in your shoulder, you're looking at about 4 months where they're trying to have you just not do very much and baby it. Where if you are doing a regenerative, if we were to treat an ACL, here in the clinic, I ask that for 1 week, you really baby that. So it's non-weight bearing, try not to walk on it, try not to use it. We jokingly say, just pretend like that area, that limb is not there. So you're not going to walk a lot. You can still get around. And then for 2 weeks, so 1 week of no activity and then 2 weeks of light activity, right? You might do range of motion, but you're not going to go to the gym yet and work out. But then after that 2 weeks, we want you to go back to regular activity. So it's kind of, we ask that you modify your activity for about 3 weeks after injection. But after that, we want you to be doing some fun foundational training with a physical therapist. We want you to be active and doing things. And so with the regenerative medicine, we're able to get people back doing the things they like sooner, which I think for a lot of our patients is very appealing because people don't want to take that time to be down, but they also don't like the idea of always living in pain or having to take a really long time down. And then as far as pain management, it's a really effective way because by going in and fixing the root cause of the pain instead of just masking it or potentially causing further damage to tissues, it's a good option of why someone would choose regenerative medicine over surgery. So the next question we always get asked is, who is a good candidate for regenerative options, such as these for some of these orthopedic issues? And so I just picked a lot of really great fun pictures of people doing varying things. And so some are old, some are active, some are young. Like I said, we treat everybody. everyone is a good candidate. I always just talk to my patients and say, are you looking to avoid surgery? Anybody who's looking to avoid surgery, who wants to do natural things, who is looking for reduced downtime, those are my patients that I am excited to do regenerative medicine on, who are interested in their health and longevity. A patient who is looking for a quick fix and just something fast, this may not be right for them. But if you ever have questions, you can always do a 15-minute complimentary phone call with one of the providers at Joy Wellness Partners, and we would love to chat with you about kind of what's going on. It's not meant to be a consult, a full-on consult, but you can also schedule one of those as well, and we can talk more about what we could offer for you. In the month of, speaking of our, what we can do, in the month of July, we are running a deal where it's 10% off all of our relief and recovery treatments at both our San Diego and our Utah locations. So call us up, let us know if you want to get in, if this is something you're interested in. But for sure, we can look at that. And that means you get 10% E2M, or if we were to do growth factors. Thank you for taking the time of coming to watch this great video. And like I said, if you ever have any further questions about what I've talked about, please feel free to reach out to either our San Diego location or our location here in Utah. But we all love what we're doing and love helping our patients reach all of their health goals and not letting any of these injuries become an issue that stops them or slows them down.